Hello and welcome to today's webinar. Before we start, we'll be having an opening prayer from Larry Campbell, Wanasia. Larry?
Can you hear me?
Yes.
Okay. Thank you to all the attendees here today. My name is Larry Campbell. I'm from the Swinomish Indian tribal community. And so I'm gonna say an opening prayer to pray for our work and pray for our health and safety and our families and our community and our nation. So as we go forward, ask each and every one of you, if you can, if you want to, pray in your own way, follow me along. I'm going to pray in the way that one of the traditional religions we still follow today is called a 19 Indian Shaker Church. So uh, unless you're on the West Coast and in tribal country, it might be a little different for you. So here goes. Goldsman, Seitasman, Seitasanteswe, oh, stuff. Goldsman, Seitasanteswe, oh, stuff. Goldsman, Seitasanteswe, oh, stuff. Dear Heavenly Father, we thank you for this day. We thank you for this opportunity to share our work and help each other in the work that we're going forward with health in regards to climate change. Again, as we face these dangerous times in our country and in our world, we pray for health and safety for ourselves and all of our families. We know that we will, through prayer, through good work, we will get through this, and the work that we're doing in regards to health will help us maybe change the world in the way they look at things and the way they do these things. So again, that as we return to our homes, hope that our homes were safe and that they were the way that we left them. With this, we say, Kolsman, Seitasman, Seitasanteswe, Masi stuff. Kolsman, Seitasman, Seitasanteswe, Masi stuff. Kolsman, Seitasman, Seitasanteswe, Masi stuff. Thank you.
Thank you, Larry. Hi, everyone. My name is Ivana Castellanos, and I'm a policy analyst with APHA Center for Public Health Policy. I have the privilege of welcoming you to today's webinar, Climate Change and Health Equity, Tribal Challenges and Actions. This webinar is being hosted by the Tribal Public and Environmental Health Think Tank, which is convened by APHA with support from CDC's National Center for Environmental Health, Agency for Toxic Substances and Disease Registry. The think tank is a group composed of community members and professionals with diverse experiences in tribal public and environmental health. The think tank focuses on increasing education and awareness of the unique public and environmental health challenges faced by tribal communities and achieving improvements to these issues. The think tank has identified 6 priority areas for tribal public and environmental health outlined in their report, Priorities in Tribal Public Health. Today's topic, climate change, is one of these priorities. To learn more about the think tank and their work, you can visit our website, which we will put in the chat section soon. Before I introduce today's moderator, I want to go over some quick logistics. Let me get my logistics and housekeeping. Closed captioning will be available for our webinar. Instructions for accessing closed captioning will be in the chat. Today's webinar is being recorded, and in the next week, all registrants will receive a follow-up email with a link to the recording, which will eventually be posted on APHA's website. And after hearing brief presentations from each of the panelists, we will have a moderated discussion among the panelists, and then we will turn it over to the audience for questions at the end of the webinar. And to submit a question, you can please enter it into the Q&A function in Zoom at the bottom of your screen. The chat function is disabled and will only be used for announcements. At the end of the webinar, you will be redirected to a survey. So if you could please take a moment to fill out, it's a 2-minute questionnaire and help us provide feedback for today's event and suggest potential future topics. And we also want to acknowledge that climate impacts vary widely depending on geographic location and the affected community. And each tribal community faces unique impacts, and each tribal community also has its own culture, governance structure, and traditional lifeways. So tribal climate work will vary in its approach and design. And the featured panelists today will be speaking to the work occurring in the communities that they serve, which is tailored to that community. Though we hope there may be lessons that we can all take away from their work. And lastly, though we particularly hope that today's webinar is helpful to tribal communities and those working with them, we welcome all to this webinar and believe everyone will be enriched by today's discussion. If you are less experienced with issues related to tribes and tribal climate work, there may be some terms or concepts discussed that you may not be familiar with, and we encourage you to continue your learning after today's webinar. As mentioned earlier, the Tribal Public and Environmental Health Think Tank may offer some resources that may be helpful to that end as well. And so now I would like to introduce today's moderator, Mariah Norwood. Mariah Norwood is an enrolled member of the Cherokee Nation of Oklahoma. She is currently working as the Infectious Disease American Indian Liaison for the Minnesota Department of Health. She received both her bachelor's degree in psychology and her master's degree in health and human services administration from the University of Oklahoma and is currently attending the Mitchell Hamlin School of Law with plans to specialize in both tribal and public health law. She is a Tribal Researchers Cancer Control Fellow, is an appointed member of Minnesota's Cultural and Ethnic Communities Leadership Council, and graciously received a 2020 Local Impact Award from the National Indian Health Board. Throughout her education and as an early career professional, Mariah has aligned herself with advocacy projects that address social determinants of health and strives to achieve health equity through policy and systemic changes paired with community-driven strategies. Thank you. Mariah, take it away.
So, hello, all my relatives and all of us who are able to join today. I am so excited to be joining virtually to moderate today's presentation on tribal challenges and actions regarding climate change and health equity. I am joining you today from Chanshayapi, which is traditional Dakota land in Minnesota, or more broadly known as Minnesota. Our presenters today will be discussing a variety of topics regarding the importance of climate and health initiatives to mitigate inequality, and how tribal governments and tribal serving organizations can address climate justice and present tribal health strategies and frameworks to address climate change and health challenges that reduce future health disparities. Climate justice is racial justice. Climate change exacerbates difficulties that Indigenous communities already face, including socioeconomic marginalization, loss or the stealing of land and resources, rights violations, and many more. I am so excited and hope that you can all take away some things from our incredible presenters today. First, I would like to turn it over to our very first presenter, Rosemary Atungurak. She is an Inupiaq activist and member of the Tribal Public and Environmental Health Think Tank. She is a former mayor and community health aide for her village, where she has fought tirelessly for the health and protection of her peoples in light of nearby oil development. She has been named an Arctic Indigenous Scholar by the Arctic Research Consortium of the United States and has received an honorary doctorate of humanities from Oberlin College. She is also a graduate of the University of Washington MEDEX Northwest Physician Assistant Program. Rosemary?
Thank you. My name is Rosemary Tadausin Kulawalik Kanyuan Sukaralik Sukarakdok Ikayok Atongarok. I was named after many aunties. My mother was Mabel Ningyok Peterson, my father Yulin Don Pierce, my stepfather Carl Peterson. I live in the village of Noxit, but I'm currently a member of the native village of Barrow, which has recently been renamed as Ukayagavik. Our village is the village that my mom was born and raised into. but I'm living in the village of my former husband, where his father raised his children and his family, and where we have raised our children. The changes that we see on a regular basis were taught the differences over the generations as our families share our traditions and culture, harvesting upon our lands and waters, feeding our families as our elders have done before us. And yet the stories change over time. In our village, my elder talked to me about the cacophony of the birds. We have over 200 types of birds that come to our lands and waters for renewal. They come from every continent, elsewhere from us, but they come to the Arctic for renewal. The importance of these birds, the glorious bald eagles, as they nest along the cliffside of the Colville River, with the intense rains that are happening, the rapid erosion along our riverbanks, the changes are breaking down the grounds that hold these nests. I saw the baby eagle on the riverbank, and it's in one of my pictures that I use for a PowerPoint. Not knowing whether or not that baby eagle survived to return to you. But as the elder spoke, she told stories of birds and how they hatch their babies. And all of her life, this bird, a songbird from the willows, would hatch on her birthday. Every year she saw that until the last decade when things were changing. The times of that bird hatching started getting earlier in the season as the changes happened. She talked to us how it's different. But as we go out upon the lands and waters and go harvest our fresh new foods in the return of the migration of the birds that come to the Arctic, we fought through legislation that affected migratory birds and made decisions that made it illegal for us to harvest during these times. She talked about the volume of the birds as they hatch and the babies grow and they add to the generations that have come to the area, hatching the new ones. But the volume has decreased. The cacophony would be so loud it could be maddening at points in the springtime into summer. And these sounds are not to the density of what they have been. The birds that come to this area are important for all of our generations because they travel to other continents in the fall time. The importance of these sharings of these birds are important for my lands and waters, but also for your lands and waters, because our other Arctic continents do not have the concentration we have. We talked about stories, how we travel upon the lands and waters, how we put our fish net under the ice, and how we harvest the broad whitefish on Auckland in the fall time, the Arctic cisco. But the dangers of having rains in November are not traditional stories that we've told, and yet the highways we depend upon to travel along the rivers are so very important to get us to where we can harvest these important food sources for our families, the importance of food security. But I bring out the most important concern, the concern we have for air quality. The changes I watch in my horizon add lights of city infrastructure associated with industry, how the flares of the natural gas emits into the air and affects our breathing, our children's health, to where we have over 1 million pounds of nitrous oxide emitted per year with approved permit processes around us. But I speak the most strongly about the food security, the loss of harvest that occurred to the west of us as villages suffered the loss of fish migrations, fish die-offs. We worried whether or not we would see the return of our fish into our rivers as we listen to these stories. It's about feeding our families the foods that our elders gave us, to us as babies, to acquire the taste of the foods from our lands and waters in the ways that we eat them. We want our children to eat the little eyes of the fish as we eat our frozen fish. My children, as they were small, would argue, "I want the eye, I want the eye." I want all my grandchildren to argue and want the eyes of our foods. Thank you.
Thank you, Rosemary. Next, I would like to introduce you all to Shasta Gon. She is the Environmental Director and Tribal Historic Preservation Officer for the Pala Band of Mission Indians in Pala, California. She has worked for Pala since January 2005 and established their Tribal Historic Preservation Office in 2008. She has also been an adjunct professor in the anthropology department at California State University, San Marcos since 2006. Dr. Gon received her PhD in anthropology from the University of New Mexico in 2011. She's the chair of the National Association of Tribal Historic Preservation Officers, a member of the Advisory Council on Historic Preservation, secretary of the board for the Native American Environmental Protection Coalition, lead of the Tribal Working Group for the Climate Science Alliance, a member of the Institute of Tribal Environmental Professionals Climate Change Advisory Committee, and vice president of the board for the Upper San Luis Rey Resource Conservation District. Dr. Gon oversees the Tribal Climate Health Project, a grant-funded education and outreach project that includes a website, resource clearinghouse, webinars, videos, and in-person presentations on climate change and health adaptation in tribal communities. Shasta?
Hello, and thank you so much for that introduction. It's always a little bit odd to hear, that kind of introduction, because it makes me feel like I sound more important than I think I really am. But I'm thrilled to be able to be here. I am coming to you today from the territory of the Payam-Cowicham people, or more commonly known as Luiseno. And the Pala Band of Mission Indians is two peoples, the Payam-Cowicham and the Kupangawacham, the Cupeño people. And I've been fortunate to work here for 15 years now. And in the last 10 years, I've been the environmental director for Pala. And in that role, I've started to look very carefully and closely at the impacts of climate change on the tribal community. And what I find is that the understanding of non-tribal folks, and I am one of them, to be clear, I am not a tribal citizen, I am Anglo, but people's expectations or understandings of what we mean when we say climate change are often quite different from what we see happening and the understandings that pertain in tribal communities. And what I mean by that is that there's no separation between the environment and the culture. At least that's true in Pala, and it seems to be true in a lot of the communities I've worked with, and based on what tribal colleagues have told me. So when we're talking about the impacts of climate change on health, we're not just talking about things like a greater incidence of asthma because we experience high heat in Southern California. High heat increases ozone concentration in the air, which can exacerbate conditions like asthma or chronic obstructive pulmonary disease. Those are definitely health impacts of climate change. But one of the more specific impacts when it comes to Paula is the impact of these climate change changes on what it means for traditional cultural practices and values. And Rosemary already spoke to that so eloquently in talking about the birds and the fish, and even the fact that the roads aren't frozen enough to be safe to travel on. And what that means in Paula or in many other communities from a health standpoint is that if you are unable to access some of your traditional food sources, for example, in California, there is a lot of reliance on acorns from oak trees. And no tribe, and certainly not Paula, relies entirely on acorns for daily food. But the acorn harvest is a very important part of traditional practice. So when somebody is married or somebody passes away or there's a birth or any sort of important celebration or commemoration in the community, part of that is to be able to have we wish, which is the traditional acorn mush. And because of climate change, the oak trees are not able to produce as much acorns as they used to. And drought and temperature extremes are affecting the health of the oak trees, making them more vulnerable to infestation by pests like the gold spotted oak borer. And so what we see is that the health outcomes associated with that, they're not just physical, they're also cultural. So that people's emotional and mental health is very much impacted by the ability to continue traditional practices. So whether it's the oak trees and the acorns here in Paula, or a lack of snow in places where there are ceremonies associated with first snowfall and those ceremonies get pushed back, or the ability to harvest certain plants for traditional ceremonies or for medicines, and the habitats for those plants are being affected, those all have a really significant impact on traditional ways of life and to people's feelings about what that means for them as a member of a tribal community. I had a friend who is Anishinaabe and gave a presentation a couple of years ago, and he talked about the wild rice on the shores of the Great Lakes and how his community was finding that the wild rice was producing less and less, and the harvest was just not what it used to be. And for him, that had an enormous impact on his sense of identity as an Anishinaabe man, to where he said, what does it mean for me and my identity to not be able to harvest that wild rice? Or for communities that rely on the salmon harvest, for example, and rather than being able to have their traditional first harvest ceremonies with the fish that they caught themselves, you have tribes in the Pacific Northwest who have to buy salmon from elsewhere so that everybody has enough salmon to eat to celebrate the first harvest. So those aren't your classic impacts that you think of in terms of health, and yet they are incredibly important in tribal communities. And so, my hope in our discussion today is that for those of you who are not familiar with working in tribal communities, you can expand your definition of what is meant by health. And I really look forward to our opportunities to answer questions and expand on this conversation at the end of everybody's introductions. So thank you.
Thank you. Can you hear my audio better now?
Yes.
Maybe. Okay, sorry. Thank you. Next, I would like to introduce Swinomish Elder Larry Campbell, who you saw earlier open us in prayer. He has been actively involved in Coast Salish tribal affairs for 40 years. He has an extensive background in cultural resources, tribal policy, government-to-government relations, and community health. Larry has a Bachelor of Arts degree in tribal government. He co-manages the Swinomish Community Environmental Health Program with Dr. Jamie Donatuto, who I will also introduce as they'll be sharing their presentation time. Jamie has worked with Coast Salish tribes for 20 years. Much of that time has been in collaboration with Larry, developing and implementing community-based Indigenous health indicators. Jamie is a researcher and a practitioner with a current focus on evaluating tribal health-related impacts from climate change, developing community-driven adaptive management projects, and managing a Coast Salish Foods and Resources community education program. Jamie completed her doctoral studies at the University of British Columbia, Vancouver, Canada, in the Interdisciplinary Graduate Program of Resource Management and Environmental Studies. Take it away, Larry.
Thank you. Welcome everyone who is attending here. Wish you could see you all. Again, my name is Larry Campbell. My Indian name is Wanastia. I am right now I'm the community health specialist. My job before this was I was the Tribal Historic Preservation Officer here. I'm a historian by nature, so I'm also an oral historian. Wandered around and gathered oral history of the history of our people, the teachings of our people, and the way that we did things before. And we use that today as the foundation of who we are as tribal people. Our tribal government has a reputation of being very progressive, and we spent years doing that. But now, as we're getting more politically sophisticated, we're looking to reach back into our tribal community and to bring our community along with us. So when we start looking at climate change years ago, I can remember my elders about 30 years ago sat me down and told me that I've been taught where all the plants and the medicines and the foods are, but when I go there, they're gone. And of course, I was a lot younger then, so I didn't understand that. I thought they were just making an observation to me. They were actually telling me, look into this, will you? And as our tribal government decided to take a stance on climate change, we start working again to look at the science, the Western science. One thing that we noticed that Western science quite often when they did their work, there was nothing in there that was really a benefit to their tribes. OMG. So just had someone come into the office. So we start looking at, how can we bring the tribal community in on this? And one of the things is that when we signed the treaties of 1855 up here in Northwest, we put 4 different tribal groups together to make the Swinomish Indian tribal community today. But we gave up all that area. And if you know resources that are not found in one area, we don't find all the resources that we need for our traditions on the Indian reservations. So they're off reservation, but after treaty times, it become government land, it become tribal land. So how do we get to it? As we start getting more and more access to these lands, again, that we decided we needed to find a way to bring our tribal community in. So we start having events like on Clam Bait. We would have a big feast for our staff and for our tribal community. Our blessing of the fleet, our first salmon ceremony, we would invite political leaders and government workers to join us and have a big feast so they could see what we're fighting for. We spend a lot of money on environmental protection, and then also we can use the culture and the traditions and the foods as a way to get into the discussions. So I think one of the things that I noticed right away and what I heard from another tribal elder is that when the research questions are being made, they don't take our needs into consideration. Even with our own scientists, it took me a while to figure out there was a reason for that. But again, now as they're doing projects, they're bringing culture more and more into that work. So we're looking to find out how can you have your scientists have tribal culture and history and things built in to the research questions, and it will begin to answer our questions. And if we can do it in conjunction with Western science, it's also an opportunity to work together. And I always say that, we need to reduce the effects of competing science, I think, as we go along. So, but again, now that we're looking to introduce, the arts, the crafts, the making of the things that come from nature. So we feel it's very important to, again, as we bring these things back and we see the confidence and we see the strength of the people beginning to improve, beginning to get stronger. We see them going to college more. And, we ask them to get a Western education to learn the rules, how do they work over there and how can we work better with them? So, but again, we have a tribal government. Again, I said it was progressive, but was also traditional in the foundation of it. You have to remember that for the tribes, our community laws, our family laws, our personal laws are dictated by the natural world, the world that we find ourselves in. We have 5 tribes within about a 40-mile large 45 miles radius of us here. We're all kind of basically the same people, the Coast Salish, but we still have differences because our environments and our natural world is a little bit different. So we developed these rules over thousands of years of time immemorial to learn how to live in a good, productive way into our communities. So with that, I just wanted to, and that's one thing, if you follow our work, you might not quite get the motivation behind the Indigenous health indicators. Was the idea of learning how to get to the tribal priorities, and that way your tribal community feels more part of the government than they have in the past. And with that, I'll stop and turn it over to Jamie.
Thank you, Larry. Hello, everyone. Good morning or good afternoon, depending on where you are. I'm speaking to you today from the Salish Nations, the Coast Salish Nations homeland, and specifically the Swinomish Indian tribal community. And what I would like to do is give you an example with an infographic that will go up on the screen that will demonstrate a little bit more about the work that we do at Swinomish and what Larry is talking about when he's talking about the importance of bringing in community and ensuring that the research questions come from the community. So many, many years ago when Larry and I began to work together, what we realized was when you think about health, most conventional health assessments don't think about health from the Indigenous point of view, and specifically from the Swinomish point of view, because each community is unique, as Mariah said in the beginning. And so Larry and I spent hundreds and hundreds of hours and a couple of years interviewing community members and looking through old interviews to think about what other aspects of health are missing. How can we group them in a way that we can then evaluate them in the context of development, or in this particular case, climate change? And how can we communicate what we find that are important priorities from the community to folks outside of the community? So what you see here are 6 Indigenous indicators of health. They're non-physical indicators that we found were missing. The words at the top are Lushootseed, which is the Swinomish language. The word in the center in caps are the words that we use when we're communicating to folks outside of the tribal community who may not understand the tribal worldviews, which are very different than Swinomish worldviews and other Indigenous worldviews. And then the words underneath are words that directly came from many, many interviews that we had with community members. So as an example, when we talk about education, we're not talking about graduation rates. We're talking about the Swinomish teachings, whether the elders are able to pass those teachings on to the next generation. And in the context of climate change, we can use these because, as Larry had mentioned, your culture is based on your health is based on your culture, and your culture is based on your homelands, where you are, the natural area around you, your non-human relatives. And so we were looking at sea level rise and storm surge because the reservation is a low-lying island reservation in the Salish Sea, and we're looking at some significant impacts from sea level rise and storm surge to important first foods for the tribe, specifically salmon, crabs, and clams, which you can see there's a community group in this infographic that are working in different ways. You have community connection, you have education, self-determination, and cultural use, resource security, and resilience all going on in this picture. So we modeled what the potential impacts would be to these 3 species in the next 50 years. We brought that information directly to the community and asked them to tell us. We know all the indicators are important. Which ones do you want us to focus on first, given the limited time and resources that the tribe has? And from there, we took those results to develop our climate change action plans. Education was voted first at Swinomish, which surprised both Larry and I, but we were also very excited about that. And natural resources security came in a close second. I will say we've done this with other tribes. They each have their own set of individual health indicators. There may be 4, there may be 7. And their own set of potentially first foods or medicines that they look at when they do these types of analysis. Potentially they're in the Southwest or in the Great Plains. So they're going to be thinking about other important first foods and other impacts. But no matter what comes from this, and we're happy to discuss this more later if folks want, is really from the bottom up. They're not outside scientists making decisions about what the tribe will do, but the community demonstrating what the priorities are and where to go next. And so we've developed education programs, and also we're currently in the process of building the first modern day clam garden, which is an ancient Indigenous technology, but it's the first modern day one in the United States to think about bolstering our resources security. So that gives you a little insight into the work that we do, and I really appreciate your time, and we're happy to answer more questions. And yes, the infographic is freely available.
So much. All right, thank you. I would like to ask all of the presenters to turn their cameras on so we can have a discussion. And since Shasta was you were the first one with your camera on, so you're going to get the first question. What do you see as the role of decolonization in tribal climate work?
Oh, wow. Now I'm wishing that I had never turned my camera on. Well, first of all, it's such an important term and concept, and we need to start by just getting people to understand what decolonization is in the first place. And what I find is that that's a conversation that I'll speak as a white person, that white people need to have with other white people, because a lot of my tribal colleagues, they know exactly what they mean by decolonization, but they get a little tired of having to explain it, even if people mean well and they really do want to learn. So I would say that's where we have to start. And when it comes from the health perspective on things, to decolonize our perspective means to listen to different ways of seeing and organizing and knowing the world. And I think that's a hard thing for a lot of people to do. I think most of us in general are ethnocentric. And so this idea that our way is the best way is taught to us. So for a lot of people, the idea of decolonizing our work in health, I think, is very challenging and frightening to them, because they figure, well, our medicine works, so why would we need to listen to what might be the best way forward with a community that rightfully may be very distrustful of Western medicine and Western health concerns. And the same is true of climate change, that it's all about kind of the classic melting ice, sea level rise, extreme heat versus what does this mean for me as a Dene person to not be able to, harvest wool from my sheep because there's no water. So that's a long-winded way of saying we have our work cut out for us in first getting people to understand what decolonization means, and second, to help them understand that they don't need to feel defensive about that, and to open their minds to different ways of seeing the world.
Building off of that, and anyone can answer this follow-up, we are currently in the midst of the COVID-19 pandemic, which has affected all of our communities in probably pretty similar ways, with health disparities that exist in Indigenous communities. This led to devastating impacts in communities where there may have already been circumstances to exacerbate some health inequalities. How are some of the root causes of both of these crises, COVID-19 and climate change, intertwined, and how do we take the lessons learned from each to move forward and build healthier communities?
This is Rosemary, and this is a tremendous concern we have for our state. The demands upon our traditional resources have been very high in reaction to the changes that happen throughout the world. Our access to resources and supplies immediately changes when you're at the end of the supply chain. These efforts to monitor our traditional foods done in ways that are looking at projects to be approved are very impactful for us. I worry so much because we had so many families that did not have someone working in their household. Some of our families didn't get fresh produce, and the demands to harvest from our lands and waters in competition with hundreds of others that also want to fly in and harvest from our lands and waters really threatens the future of our food security. Thank you.
Thank you. Would anyone else like to add to that?
Yeah, this is Larry, and I would say that, if you look at the pandemic today, in the past, if we ever saw a pandemic or contagious disease or something that's known as a national emergency, it's like diabetes hit the tribal communities long before the federal government considered it a national emergency, I guess you'd say. And I think through that, over the years, that we learned better how to take care of ourselves, especially now that we have our own medical health clinic and our own nurses, and we train them to get to know the community better rather than the doctors' firms that we contracted with for many years. So I think with better health, we stand a better chance into resisting, say, like the pandemic, not only for the tribal communities, but from the world the United States as a whole, that I think that with better health, that the pandemic, we can slow it down. We can minimize the consequences of that pandemic. And that's one thing I'm really happy to see in our community. Our people are following the recommendations of how to protect ourselves, and our tribal government is making doing a tremendous job of trying to protect each and every one of us. And so the pandemic has hit our community probably with a lesser extent than some of the communities around us, just because that we're trying to follow a good health plan. And again, like we say, that a lot of that comes with the foods that we eat. Doctor said years ago, they finally figured out that fish helps the heart. Fish is good for the heart. And for us, it's not only for the body, but it's for our spirit too, that really demands that. When we eat fish or deer, elk, clams, crabs, we call it our spirit food, that we eat it because our body craves it. And so it not only craves it for the body, but it craves it for the spirit. There, it rejuvenates us. Thank you.
That actually lines up perfectly for our next question. Climate impacts are often closely related to issues of food, which I think is something that we're seeing even more prevalent with light of the pandemic. How is food accessibility and food sovereignty addressed in your climate work?
Amy, were you going to go? I saw that you're unmuted.
Can Rochambeau for it. I mean, I think that it's something that we've informally discussed among the folks that do this work often, which is that food sovereignty is a really important movement that's going on, particularly in Indigenous communities right now, as a very tangible way to think about sovereignty in general, but also to reclaim something that isn't just about calories, but is so deeply connected to your culture and to your worldviews and to who you are, is very powerful and is really resonating, particularly with the younger generations with whom we work and the elders who are able to pass this information on. So I think in terms of thinking about food sovereignty movements in particular, and in the context of climate change, one really good example that we're able to share is just thinking about the fact that, you know, the Ish people, the Swinomish people, many of the other Coast Salish nations have Ish at the end. It means, you know, of the salmon, people of the salmon. And so if salmon populations are plummeting, in part because of changing oceans, then the people are being, how can I say this? People are being very creative in their ways in thinking about how to continue that connection. And one of them, as Larry mentioned, was really focusing a lot of time and effort on food sovereignty and continuing to be able to have access to these populations and having these fish populations be viable. But also there's a lot of other really creative things going on. Like if there's migration going on, being able to create MOUs with other Indigenous communities to say this particular population is moving into your territory. If you allow us to be able to continue to access this particular first food, we will be able to share some knowledge with you about that. And so I think thinking about food sovereignty and how it's so important in so many communities is one way to be able to talk across the divide of knowledges. So outside of Indigenous knowledge to non-Indigenous folks who also understand that food is important in many ways. I mean, when you gather around the table for your own celebrations, no matter what your background or religion is, there's going to be certain foods there that are more than just for calories. And I think so in thinking about food sovereignty, it's a great way to be able to connect across cultures and across worldviews, but also to understand how very important it is for tribes and how Indigenous peoples have been adaptive for centuries. And so this is another example of how people are going to continue to use their resilience and the food sovereignty movement to continue to move forward and address these unique issues of climate change in their own ways.
And if I
This
could,
is Rosemary.
go ahead, Rosemary.
I was going to say that it's about breaking down of the understanding and elevating the discussion into the many different layers about the importance. I know when I was dealing with the Arctic, they didn't even have health connected with food security. But it's about getting into the processes, educating the young voices, and bringing them with us.
And I would add to it a broader consideration that, you know, food sovereignty is an important part of overall sovereignty, political sovereignty, cultural sovereignty for tribal nations. But I think we also need to pull back and look at the issue of food as a driver of climate change impacts overall, that we have developed an economic system based on, you know, people in areas where there is high level of food accessibility, you know, grocery stores and what have you, that there's now this expectation that there's foods that should be available year round. I was in the grocery store the other day, and there's strawberries. You know, it's December. I mean, I realize I'm in California, so I'm lucky from a produce standpoint, but still, those strawberries are not from California. Those strawberries are from South America. And when did we become a society that decided that we should have access to strawberries in December? And so something I think we can learn from traditional foodways is that the foods have seasons, and you're going to harvest those foods when they're in season, and then you're going to save them to eat throughout the rest of the year. And that's a lesson for us in terms of climate change adaptation, of perhaps getting away from this notion of total availability and, you know, completely processed kinds of foods. And that becomes somewhat circular in terms of these food sovereignty movements in tribes, because for so long the only real accessible food was the government commodities provided by the federal government, which are, you know, unhealthy from A to Z. And so it's not just about restoring individual and community physical health, but global health in terms of making changes and perhaps taking a look at the traditional ways of food seasonality as a model for us for overall adaptation.
Thank you all so much. Go ahead, Larry.
I just watched a special on John Meacham, who wrote a book called The Soul of America. And in it, he talks about societal change don't come without, quickly, without a lot of controversy and a great deal of emotion and conflicting ideas and how it goes. And that's one thing ART tried to do. They saw the argument between the scientists, does climate change exist? And we decided not to enter into that argument, but to go to say, climate change is here. Let's go ahead and look for the how do we solve this problem within ourselves. And again, that's what started Jamie and I's work, being able to go with that and look for how to solve some of these problems. There was something else, but I forgot. So.
All right, and then I have one more question for that I'd like all of you to answer. And then we'll switch to some questions from the audience. So if you do have any other questions that you would like answered, please use your Q&A function within Zoom, and I can make sure that we get those fielded to our presenters. But the final question I have for each of you are, what are your priorities in addressing climate change in the next decade? At the tribal level, at a regional level, at a national level, or a global level, however you guys would like to address that.
Well, I'm unmuted. I'll
For,
start. Oh no, Rosemary, go ahead.
for me, I really think on the statewide level, the issue of our caribou and fish are going to be tremendous in the next decade. It's unifying the communications throughout the tributary so that we get the voices from the end of the migrations as well as those that are meeting the migration, and build the protections that we can agree upon to help us all survive these changes that we're facing.
So from a global level, I say this tongue in cheek, but we have to overthrow capitalism. Now, maybe that's not the most ideal way to solve our problems. But in all seriousness, one of the things that I'm trying to do with my work is to introduce more people to the concept of reforming or re-strengthening community. And I think that if we can, I know that sounds really nebulous, it sounds really vague, and we are doing concrete work here in Pala to strengthen the community against some of the environmental and cultural effects of climate change. But in general, there are lots of things on a global level and in this country that we need to do in terms of dealing with structural inequality, lack of access, and inadequate healthcare for communities of color, and certainly that's true for Native communities. Here in Pala, from the COVID, we've got about 800 people who live here, and there's 129 confirmed cases of COVID, which is well over 10% of the community that's been infected. So we've got to look at our overall approach to we as a human community in terms of deciding what sacrifices we're willing to make to be able to reduce these impacts. And I think that an embrace of people as valued as opposed to things and economies as valued is something that we really need to push for, so that we don't get all of our satisfaction from eating Cheetos and buying a new pair of shoes. Although I'm guilty of that. I've got like 50 pairs of shoes. I mean, seriously, and I don't have kids, and that's my excuse. If I'd had kids, I'd have to buy them shoes, so I'm buying their shoes instead. So I realize I'm a hypocrite, but in seriousness, that's something we need to consider. It has to be global change in behavior. So, I wish I had a magic wand to do that, but I think tribes are a good model to follow for embracing community.
I think the one thing that is happening in Indian country for the last 20 years is that as the world has got smaller because transportation got a little bit better, we have a lot of conferences in Indian country that brings the tribal communities from across the nation, together. And the wonderful thing about Indian country is that we're willing to share successes, but also share our failures. And when we can do that, it helps other people, other tribes, cherry pick the ideas that are the concepts that we present to them and take it and run it their own way. And that's why we saw the idea of taking the Indigenous health indicators out to a national level that, again, then if they decide to adopt a process and go through it, then we could take a look and see what they did with it, and maybe it could help us improve ours. So again, I think that the pandemic and coastal change are two really serious threats to our continued existence. I think that will help us in time, hold a short order, that we can begin to make these changes in the way that we conduct ourselves in our lives, and that will go for, say, long-term change. That'll go on. We looked at it as 567 tribes in the United States today. So we thought that would be nice if we were all doing the Indigenous health indicators, and it would provide, a steady source of resources to be able to continue this work. It's important that we continue this work.
I just wanted to follow up. I'm in the question and answer and answering people's questions. And there are several questions about how to work with tribal communities and what would be top priorities in terms of how to interact with tribal communities if you're not from a tribe. And I just want to say this to everyone, because I've seen the question come up at least 3 times in the question and answer section, to not say anything at all and to listen. That's the most important thing that I can tell you to do, because I think even super well-meaning people really come in and they say, I know how to fix those issues, but you don't, because you don't understand the community and you don't even know their worldviews. And I remember Larry used to tell me, if you work at Swinomish, it's going to take you 2 years to even begin to understand the Swinomish worldview. And if you have a degree or a higher education, it's going to take you a heck of a lot longer. And he says it with a smile, but he's being honest, because you've spent so many years learning in a very particular way that you need to unlearn that and to be open to a different way of learning. And so, I think it's great that there's a lot of allies like myself out there who want to support Indigenous people, but the best thing you can do is to couch your own opinions and to listen and to be quiet and to learn. And also never interrupt an elder. I'll just tell you that straight off. That will definitely get you kicked out of the room.
Yeah, I was able to teach Jamie on 5 or 6 hour trips across the country. I had a captive audience because she couldn't go anywhere. So I mean, this work is a combination of bringing our 2 cultures together. My part is necessary and her part is necessary too, because sometimes that's how we have to communicate it to the outside world. And you always have to remember that as tribal people, we're very private and secretive. We've been taught to be that way so that we could retain our tribal identity. One of my neighbors over here said that, well, we always knew you were over there, but we don't know nothing about you. And I said, that's not your fault, and today's world, the tribes are trying to figure out how to communicate these ideals that don't give away too much, but also gives a snapshot of what we think is important, and hopefully it provokes thought and changing the way that things have been done in the past.
People ask for a couple of examples of some of the way that we work, and I'll give you one. And this is an example of, as an outside researcher, when you want to partner with the tribal community, think really carefully about why it is that you want to partner. I mean, are you feeling like you really want to be supportive, or is it because you are hoping to get something out of it? And I'm saying that because what we do with all outside researchers is we require them to have data sharing and ownership agreements with the tribe before they can work with us, which means that whether you're from industry or government or academic, any data that is co-developed with the tribe is owned by the tribe. Let me say that one more time. Anything that is co-developed with the tribe is owned by the tribe. You cannot publicize it, you cannot publish it, you cannot share it without the tribe formally approving it before it goes out. And I think that's really hard for a lot of academics. And I've seen a lot of people particularly walk away because they have their own interests essentially at hand, and they can't give up the not being able to publish under their own name. And so they walk away. And so I'm just saying that particularly with Swinomish, but with other tribes as well, something to think about when you want to work with a tribe, about what it is that you want to get out of it.
Something really heartwarming that I have seen in that regard is I've seen researchers who have, some who are Native and some who aren't, have been in community for a really long time. And the reason that they have successfully been able to stay in academic and coexisting with tribal people is that they have told tribes that we'll do this work with you because it's important and it matters, and we will do it in the way that is respecting of your people, because you're the ones who have the knowledge. And if we can't change anything based on the work we're doing, then like, why should I as a researcher be able to benefit off that? And so they'll skip that publishing piece just because what's publishing when you're not actually changing health outcomes is something I think too, and building off of something, I think it is incredibly important to reiterate that tribes and other BIPOC communities have the best solutions for their community. At times in Western culture, but people who live in community know how to fix problems, or they may not even see what you're seeing as a problem. So I think that's super important when coming into tribal communities, just to think about how to let that community or other BIPOC communities be the ones who are championing their own projects, championing their own decisions. And then let me see. I'm trying to pull up questions from the Q&A. We have one that says, what are your suggestions to help with the mental health effects of extreme weather events and climate change for Indigenous people?
I can tell you a little bit about what we've done in Paula. One of the big projects that we've worked on here is the Tribal Climate Health Project, and that was grant funded through the National Indian Health Board with money that they received in turn from the CDC. And as part of that work, we did vulnerability assessment and climate adaptation planning for Paula, and part of our goal was to pilot that so that we could figure out some just general practices that other tribes might be able to use themselves. And I think Larry and Jamie did something similar with their indigenizing of the brace framework for Swinomish. And other tribes can take a look at that and tailor it to their own unique tribal communities. One thing we developed for the mental health side of things was what we call a psychosocial resilience framework. And it provides some basic strategies for dealing with some of the mental health aspects, but they're basic enough that they can just be used as kind of the skeleton, if you will. And then individual tribes who want to use that skeleton can kind of clothe it with whatever culturally appropriate muscles and organs. And now this analogy is getting creepy, but they can develop it in a way that is going to be best suited for their communities. But it starts with some really basic notions that I think are applicable to almost any community, which is community itself, strengthening community, but developing culturally specific and workable ways to provide strength and resources for people. And our goal is to avoid having to go to the professional level of things, because the community is self-supporting, and individuals within that know who they can go to or what kinds of practices they can engage in to help them deal with stressful situations. And then from just a purely pragmatic standpoint, we've provided some educational resources for Paula tribal members about how to deal with stress and resources that they can tap into. And so in that way, we have provided some of that strengthening for the community.
Yeah, this is Larry. We're starting to run into that here, is the fact that when we have loss of life or death in our community, it's usually a community event that we're all trained to, whenever we have a death or a crisis in our community, to be able to drop whatever we're doing and go be with the families that are in trouble. And because of the pandemic, it has kept our ability to gather mute. And so our tribal government had to figure out a way to, how can we, because the funeral part of it, we see it as all part of the healing and as part of the, trying to get our families back on a healing path so they don't live with, the sorrow too long. So we find Facebook has allowed the people to communicate with each other, to be able to, show that they're supporting, even if they're in the background, saying their prayers for the family, and letting the people know who are taking care of family, with just a little bit of people around them, that they're not alone. So again, our elders told us when we formed our government in 1936, I think, from the Indian Reorganization Act, we had to pick a name for ourselves. And our elders at the time, our leaders at the time, chose the Swinomish Indian tribal community. And the community is an important word there, because they said that we'll have to retain our community values if we're going to continue our tribal identities. So again, that's the way our community is. People always warn people who come to work with us in outside venues that be careful. If there's a death over there, everything shuts down. And so I think people have gotten used to that. They know that about us going in. So I think that's one way that we're trying to deal with, because being cooped up, staying at home, and not seeing people, on a daily basis that you're used to seeing can be quite traumatic. And especially with our elders, they're the most susceptible to the pandemic. So again, that we take special care of them. When we did the furloughs here, I was the first one they sent home. So even though I'm still on furlough, I still come down and do stuff. Of course, we all do stuff, over and beyond our jobs. Thank you.
Thank you all so much. Unfortunately, I don't think that we have much time for any more questions from the Q&A to be answered out loud. I know that these are really important issues that we could go on talking about all day. I know I, for one, can be really long-winded when I'm passionate about things, and this is a subject I think you can see that myself and all of our panelists are passionate about. But it looks like we are out of time for today. And I would just like to thank all of our panelists for today's rich discussion, and thank you for all of the attendees for joining us. We will soon be sending out all attendees and registrants a follow-up email next week with the link to a recording of today's webinar. We also ask that you please fill out a brief survey to provide us with feedback on today's event and suggest potential future topics. This concludes today's webinar. Thank you.
Thank you.